I am Dr. Kellianne Arnella, and I'm an occupational therapist that specializes in all things neurological rehabilitation, so stroke, concussion, brain injury, and other neurological conditions as well, like Parkinson's and MS. I've been in OT for 15 years and have recently opened up this page as a way to share a little bit more about what it is we do, not only in OT, but in the world of neuro rehab as well.
Okay, great, great. Yeah, we can start off by me asking you, how can patients maximize their time with their occupational therapist?
Yeah, I think that's a really great question. I would say, you know, this healthcare world has been changing for a long time. It's going to continue to change. I feel like over the last 15 years, we actually spend less time with our patients. So maximizing the time that you are with your therapist is really important. Um, I think having a good understanding of your role as the patient in rehab would be a really good way to start. I often say that as therapists, we're merely the guide, and you are the ones that are putting in the work and the effort outside. So, really going in with that mindset, not that you're going to make all the recovery in your time with the therapist, using that time with your therapist as a way to guide what you're doing outside of your sessions, as well as really being collaborative and realistic with goal setting. And your therapist should definitely be able to guide you with this. So being able to, and by that I mean um, being able to, take the big goal that you really want to work towards and be open to breaking it down into smaller components, and smaller components of the goal so that they're more achievable and that each session really feels like you're making progress.
Okay, great. I really, really connect with that. I think I had to make that mind shift too, is because sometimes I'd have my scheduled times and I'm like, okay, that's when I'll do the work. But I realize sometimes it's good to learn. And I guess it goes along with school too. A lot of times I'm like not there, like listening to the lectures. And, I think just like being able to listen as much as I can and then take it when I go home and kind of use those tools that they have teach me or coach me and, you know,
Right, absolutely.
use.
Yep.
Yeah. So,
It's Yeah, it's sort of that of application, right? So applying what you've learned, applying what you've worked on, and really understanding that it's a weird way of thinking of it, actually, because you're asking how do you maximize your time with the therapist, and I'm saying you maximize your time with the therapist by maximizing your time outside of therapy, right?
yeah.
Um, so just an interesting way of thinking of it.
Yeah, so it is. From your experience, what have you noticed that frustrates patients the most with their rehab?
Yeah, this is another great question, and I think it actually does go nicely with the previous one. I think it's really that understanding that this is a marathon, sometimes not a sprint. And really, it's so like the prolonged recovery, which is very, that's the nature of neuro rehab. These aren't orthopedic cases. They don't heal in 6 to 8 weeks. Um, they are multi-layered, and sometimes we go in treating one area and then uncover something else that's impacting that area as well. So I think just sort of the depth and the length of recovery can sometimes be frustrating to patients. But I think with proper education and guidance and structuring of programs and education can really help to manage that frustration. Just like I said previously, when you're taking those big goals and making them into smaller, more achievable and understandable goals, um, while still working towards the big one. We're not taking that big goal away, but understanding that we have to work on the steps at the bottom of the stairs in order to get to the top of the stairs first. um that I think is sort of like what people get frustrated with, and um how we kind of try to work around that.
Yeah, big time. What was that thing last time you mentioned about, or you gave like a comparison about breaking a bone? It's not the same.
Yeah,
Is it like
so
that?
what I was saying about like it's not an orthopedic condition, right? So you can break a bone and they might give you a healing time, or they're like, okay, we'll put this cast on you, and we're going to check back in 4 weeks, in 6 weeks, and typically, after a surgery, you're given 6 to 8 weeks of healing time, right? But your brain is not your brain, your spinal cord, your neurological system is not um, it's not a bone. It doesn't work that way. It operates in a completely different way. So healing is different and healing time is different. I often also say that it's a message issue. It's not a strength issue. And I think a lot of people come in thinking that they can strengthen the area that's impaired with weights or with just exercise. But the neurological system works differently. It's not the musculoskeletal system. It's not a broken bone, and it does take um, a different set of or a different approach to healing.
Yeah, big time. That's the shift that I'm making too. Is yeah. At first, I was focused a lot on gaining strength, and I feel like it's the other side too. And a lot of times I do that. I think about form or just the movement or the motion. I
Hmm.
think that's really important too.
Yeah, absolutely.
Yeah, I did have there was a question that one of the stroke survivors asked, and I wanted to bring it up here. And she did ask, as far as stroke survivors, like past like 10 years, what are things that they can still do with their healing?
Yeah. So this is a huge, there's a big myth that you only have 6 months after a stroke to recover. Where that comes from is the understanding that I'll say it this way, your greatest capacity for change, right? So if you go, like you're going to have a big jump in healing in those first 6 months, right? Or 6 months to a year. And yes, neuroplasticity is certainly very excited during that time. So yeah, you will see more change and a greater sort of influx of recovery. Okay. But
Hmm.
after that time, it doesn't mean that your healing time expires, right? So I say there's no expiration date on neuroplasticity. Yes, as we get older, things change. Our bodies, it is harder to excite neuroplasticity, but it doesn't take that principle of your brain to be able to restructure and relearn different skills. It doesn't take that away. And I think that that is really what's important to share with people who are years out from an injury, that you can still create change. And I'm not saying we can go from complete paralysis to fully functional, but you can work towards even a 10% of change. And it's not always in the way that um, I think I think sometimes also neuroplasticity gets put out there as like this magical healing property, but it's actually not that easy. It's just something that we have to kind of, um, you know, i- i- work with and understand in order to make and drive change. But what I'd say is, especially for people who are 10 years out from their injury, even more, we've had patients that have come um, into our clinic, and there is still a capacity for some element of change. It's really day in, day out working really hard towards recovery, towards changing your functional status, how you're able to incorporate, the part of your body that's impaired, um, and really kind of you can really do wonderful things, even many years after an injury.
Yeah, I really like hearing that too. It gives me a lot of hope. Yeah. Well, I really appreciate your time. I know, yeah, with the time adjustment was a little bit interesting this morning. Yeah.
We're blaming the what daylight savings.
Yeah, you know what? We don't have daylight savings in Arizona, just so that you know. Yeah. I don't know if you
Oh,
knew that. Yeah.
oh,
So
that's
I was like, oh, what is this?
oh yeah. Well, in New Jersey we have it.
Oh, okay.
It definitely got us. So, but at least this gets recorded, and we have much better sound this time than last time,
I know.
right?
Oh, yeah. I listened to it again, and I was like, I don't know what was going on, but you sounded good.
Yeah. It's all good.
But yeah, so yeah, that's why we're like, okay, let's do it on Instagram. And I think, we do have more followers on here, so hopefully more people can see it. And I can share it on the other platforms too. But yeah, Dr. Kellianne, yeah, let's, when you have some more time in the future, I think it'd be great to have these OT chats, and I think people benefit a lot from it. I'm getting a lot of good feedback too.
Absolutely. If I mean, if you're gonna post this, if anyone has a question, feel free to reach out. I'm happy to try to help and answer it as best I can.
Okay, perfect. Yeah, don't forget to follow her page too. All right, Dr. Kellianne, thank you so much for your time, and sounds
Have a
good. And
great
also,
day.
okay, you too. Thank you.
All right, bye.
Bye. Bye, guys.